welcome to lecture number 13 and part 2, or part 2 of lecture number 13 on our series on drugs and human behavior. Today we're going to finish up our discussion of sedative hypnotic and anxiolytic medications by talking about benzodiazepines and their alternatives. We'll do a brief history of benzodiazepines, talk about their pharmacokinetics, their use in the elderly, their pharmacological effects, clinical uses and limitations, side effects, abuses of benzodiazepines along with some advantages and disadvantages, talk about the negative effects of benzodiazepines on memory, talk a little bit about Flumazenil, which is a drug which automatically reverses the effect of benzodiazepines, talk about what are called non-benzodiazepine benzodiazepine receptor agonists, which are drugs like Ambien, finish up with some discussion of general anesthetics, and talk a little bit about selective serotonin reuptake inhibitors as a potential treatment for anxiety. Well, let's start with a brief introduction to benzodiazepines. These are anxiolytic drugs. They're the most commonly prescribed psychotropic drugs. Psychiatrists write less than 20% of U.S. prescriptions. Most commonly, they are prescribed by general practitioners, and their use is appropriate for people who have anxiety. Anxiety can increase cortisol levels and compound the effects of stress, which can result in major depressive disorders. So these are appropriately used to treat anxiety. The problem is that they do lend themselves to abuse. So benzodiazepines work the most quickly of any anxiolytic drugs. Selective serotonin reuptake inhibitors and other related drugs can take several weeks to have any sort of effect. So benzodiazepines are particularly useful for acute treatment of anxiety. So people with panic disorders should probably have something on hand in the event that they have a panic attack, something along that sort. Cognitive behavioral therapy may take months, but may last longer after treatment is finished. So over the long run, cognitive behavioral therapy may be the sort of long-term treatment with a short-term course of benzodiazepines available as needed only, and certainly not as a daily dose. So what are they used for? Again, these are to treat anxiety, so they are anxiolytic. They are also anticonvulsants, so to treat epilepsy. They are very powerful drugs that will are very good at stopping seizures. So particularly VIII is a particularly powerful anticonvulsant, as is lorazepam. They can be used in alcohol detoxification to prevent seizures in that instance. They are sedative hypnotics, so they are used to treat insomnia. They are central muscle relaxants, so to treat spasticity, particularly Valium or diazepam is the most potent muscle relaxer in this class. They are also used as a potentiation of central nervous system depressants, so in anesthesia. So in particular, triazolam or halcyon and midazolam or VIII are used in anesthetic settings, and we'll talk about their use a little bit more in conscious sedation procedures, as we already discussed in the first half of this lecture series. So in terms of the pharmacokinetics of benzodiazepines, their dosage and half-life varies significantly for the 12 drugs that are available in the United States. Most of these drugs are lipid-soluble and are therefore taken orally. Midazolam is the outlier in this sense. It is water-soluble only and cannot be taken orally. Only midazolam, diazepam, and lorazepam are available in any sort of injectable form. Midazolam is given intravenously. Diazepam and lorazepam can be given intramuscularly or intravenously. Again, midazolam is only available as an injectable. It is available in Europe as a nasal spray for acute treatment of seizure. And so if someone has a seizure, they can use a midazolam nasal spray. Because it's water-soluble, it's available in that formulation. Some of these drugs have active metabolites that can increase their effective half-life, and so that's always something to keep in mind. So let's take a look at these examples of the available benzodiazepines. The shorter acting of these are midazolam, which is VIII, or triazolam, which is halcyon. These drugs are not used to alleviate anxiety. They are generally always used in a sedative hypnotic sense. Midazolam and triazolam are often used in conscious sedation procedures. So if you are having an endoscopy, a colonoscopy, having your wisdom teeth pulled, these are the drugs that are most often used. The intermediate acting drugs are alprazolam and lorazepam are the drugs that are used the most, I would say, in this series. Temazepam has some use, but for the most part it's lorazepam and alprazolam, and certainly alprazolam or Xanax is the most common of those. Alprazolam is available in varying dosage from a quarter milligram all the way up to 5 milligrams. Personally, I have a prescription for quarter milligram Xanax that I take very occasionally. I can't imagine taking the 5 milligrams. That's because of both my size, and it's not something I take very often, but some people certainly need that heavier dose. The oldest of these drugs is Librium, or chlordiazepoxide. Clonazepam, or Klonopin, is a longer-lasting benzodiazepine that exhibits some antidepressant formulations, but not much. Clorazepate, or Transine, is another of these longer-lasting, and then diazepam is Valium, which is probably one of the other most commonly prescribed in this class. So, again, of the available benzodiazepines, the shortest acting are Versed and Halcyon with about 2.5 hours. Xanax has about a 12-hour half-life, with Ativan having about a 15-hour half-life. Again, depends across individuals, depends on an individual whether or not they've, for example, if they've consumed grapefruit juice, these will be lengthened for some people. They're greatly lengthened in older adults, so keep that in mind. Klonopin has a much longer half-life, about 30 hours, and Valium is sort of in between, which is 24 hours. Clorazepate is first pass metabolized into nordiazepam, and so it actually kind of becomes nordiazepam after its first pass metabolism, whereas diazepam, started with a half-life of 24 hours. Its active metabolite, nordiazepam, has a 60-hour half-life, so it's a pretty long half-life. So if you're sensitive to these kinds of drugs, Valium and Transine might really be problematic. Speaking of that, benzodiazepine in the elderly are particularly troublesome. The elderly have a reduced ability to metabolize benzodiazepines, particularly the longer-lasting benzodiazepines. So it's probably worth considering for an older adult either not prescribing or certainly not prescribing something longer acting, but something shorter acting. The elimination half-life for diazepam and nordiazepam is 7 to 10 days in the elderly. So that's a really long time for someone to be influenced by these kinds of drugs, and they're certainly associated with increased falls, etc. So for shorter acting drugs like Xanax, the dose is about half, but they do have significant side effects. They can cause dementia, they can be certainly depressive, and they are associated significantly with increased rates of falls and hip fractures. So it's certainly something to watch out for in older adults. In terms of the pharmacological effects of benzodiazepines, all of them are pure GABA agonists. They fully facilitate GABA binding. At low doses, they moderate anxiety, agitation, and fear by actions on receptors in the amygdala, insula, and orbitofrontal cortex. So they are very good at relieving anxiety. These are really good drugs for some phobia situations. So for example, someone who's claustrophobic, a dose of benzodiazepine prior to having an MRI is certainly a clinically appropriate thing to do. Again, personal experience, I can tell you that I have serious claustrophobia, and it seemed to be getting worse and worse with each MRI that I had done. And so finally, I started taking Xanax beforehand, and am much less fearful of that as a result. You can, of course, get some amnesia and confusion, and these are due to effects on the hippocampus and the cortex. And then finally, the antispasmodic or muscle-relaxing qualities are due to the anxiolytic properties and the GABA receptors in the spinal cord and brainstem, getting those muscles to release that tension. So Anxiety causes muscle tension, certainly no surprise there, and so the tenser your muscles are, the more tense you get, so they can kind of be a self-fulfilling or a sort of almost feedback kind of loop. So getting those muscles relaxed can be certainly a way to try to get somebody more comfortable, and so they're again appropriately used for that. So for the current clinical uses and limitations of these drugs, certainly treatment of debilitating anxiety, treatment of insomnia, treatment of muscle spasm and tension. Sometimes these drugs are used for intentional anterior grade amnesia, so in surgical cases, oftentimes these drugs are given to cause amnesia during surgery, so if someone either wakes up or if they have to be awake for an unpleasant part of the experience, they don't remember it, and so are therefore less traumatized in theory. One thing to keep in mind is there are some genetic effects of the use of these drugs. So I think we talked in several lectures ago that people with red hair oftentimes metabolize these drugs more quickly and require higher doses. So something to keep in mind. If you have genuinely red hair, that genotype may require higher doses. Obviously start at whatever dose you might be prescribed. But if it's not enough, talk to your physician. Always talk to your physician. So symptomatic treatment of panic attacks, again, this is another very good use of these kinds of drugs because they are only used on occasion when someone might have a panic attack. And again, non-specific treatment of anxiety that might accompany other psychological disorders. Always have to be careful with polypharmacy, but any anxiety that might go along with other psychological disorders, this might be a good route for that. And then finally, treatment of alcohol dependence. There is, of course, some pushback on using one drug to treat another drug or replacing one drug with another, and certainly with alcohol dependence, a benzodiazepine to transition someone through that withdrawal period is appropriate. There's always the danger that someone will then transition into just using pills instead of alcohol. So some of the limitations of these drugs, they have amnesic effects. You can get rebound increases in anxiety and insomnia from withdrawal. They are addicting drugs that can be characterized by physical and psychological dependence. Certainly it can be problematic in patients with alcohol and substance abuse problems. One thing to keep in mind that these drugs have some pretty severe withdrawal. So someone who is used to taking a daily dose has to be able to continue that dose. And so one of the important things to understand is if somebody's taking Xanax every day, especially if it's somebody who's taking it like 3 times a day, they can die from withdrawal. In fact, there are some cases of people who have been arrested and denied access to the medication and have died in prison as a result. So very, very serious potential for withdrawal. So as single agents, these are not effective in treating comorbid depression, which often accompanies anxiety. They can make chronic pain worse. And again, they can carry some potential lethality and overdosage when combined with alcohol or the opioids. All of these drugs depress respiration, and so when you combine them with other drugs that depress respiration, that can happen. Benzodiazepines, even at low, normal clinical doses, impair real-world driving performance, so you should never drive under the influence of these drugs. Again, 1 milligram of alprazolam impaired driving similar to a blood alcohol content of 0.15, so that's pretty impaired. Women seem to be more affected by benzodiazepines than men, and again, significant detrimental effects on driving, memory, and divided attention. So very significant effects of these drugs in terms of cognitive functioning and ability. So something to watch out for, and certainly you should never drive under the influence of these particular drugs. There are well-indicated and valid current uses. They are used all the time as pre-anesthetic medication for sedation and amnesia. Again, intentional drug-induced anterograde amnesia, very common use. Certainly for acute treatment of debilitating anxiety, and it's okay to accept the accompanying impaired cognitive and psychomotor performance impairment. Sorry. These drugs are not to be used for chronic treatment. They are to be used for acute treatment. So people should not be on daily doses. They should not be taking it several times a day. There are other treatments available that are better than being on benzodiazepines. So they are appropriately used for panic attacks, for acute anxiety, for alleviating immediate anxiety, but for long-term treatment of anxiety, better plans are some of the SSRIs we'll talk about, and also cognitive behavioral therapy. So here are some of the side effects. Of course, people are sedated, they get drowsy. As a result, they lose muscle coordination or ataxia, they get lethargic, mentally confused, they have motor and cognitive impairments, disoriented, slurred speech, amnesia, which presents as sort of dementia and hypnosis. You also have both physical and psychological dependence as possible side effects of this particular drug. Again, can't emphasize this enough. Someone who has taken this drug or these drugs daily over long periods of time will go through significant withdrawal. And as a result, they have to be withdrawn slowly and cannot quit these drugs cold turkey. It is incredibly dangerous to quit these drugs if you've been taking them daily. This is not something to just suddenly stop taking, because it can result in seizures and in death. One of the other important side effects to understand about these drugs is they do have possible fetal abnormalities. That is, some of these drugs, particularly midazolam or Versed, can affect the chromosomes in both sperm and ovum. So birth defects can be caused by use from either the mother or the father prior to getting pregnant. So if you are someone who takes these drugs regularly, certainly talk with your doctor. If you are going to undergo any sort of surgery and are planning on having children or getting someone pregnant or being pregnant or reproducing in any way, you want to talk with your doctor about either alternative drugs or figuring out how long this side effect can last, because it can be for months. And so something to be very, very cautious of. The final most important side effect is significant interactions with alcohol and other sedatives. These are drugs that are not to be combined with alcohol because they can cause significant effects. So there are certainly some abuses. We don't want to use these for long-term treatment of life's anxieties. Treatment of drug-induced REM rebound and insomnia is a problem because oftentimes these inhibit REM sleep. So occasional use for insomnia is okay. Chronic treatment of insomnia is not. We'll watch out that these can be used for as date rape drugs, particularly Rohypnol. Long-term treatment of alcohol withdrawal is not an appropriate use of that. And then self-medication for psychological distress. Again, we talked already a little bit about self-medication in a variety of contexts. People can abuse these drugs for self-medication. And then finally, long-term acting benzodiazepines should never be used in the elderly. So those are some of the abuses of benzodiazepines. Some advantages of benzodiazepines is they're safe. They have very low toxicity. Unlike barbiturates or alcohol, they do require pretty high doses to be lethal. They do not induce metabolic enzymes, so they don't accelerate their own metabolism, so you don't have to constantly keep increasing the dosage like barbiturates. And while they act on central nervous system and peripheral organs, they are not impaired. So this is not something that induces major hepatic difficulty. Now, of course, if you are somebody who drinks chronically, your liver is already impaired, so keep that in mind. Disadvantages of these drugs, they of course do induce amnesia. You can get some tolerance at the neural level. There is severe potential for dependence and withdrawal, and certainly some potential for abuse, and of course potentiation of other sedative hypnotics. So we don't want to take these drugs in combination with other sedatives. I'm going to spend a little time talking about the mnemonic effects of benzodiazepines, because this is an area that I've conducted research in, and it's an area that I have some expertise in. And I think it's an important topic because most people don't understand how dramatic this memory effect can be. Because of their effects on GABA, all benzodiazepines have the potential to cause some level of temporary amnesia. This is always what we call anterograde amnesia, which is an inability to form new memories. So this doesn't affect memories that are already formed. So nothing will be affected in terms of what you did prior to taking a benzodiazepine. This is primarily for episodic memory, so this is a reduction in memory for life's episodes. This, of course, may be useful for pre-surgical preparations, but it may not be a problem if they're taken for sleep, because obviously you don't remember usually being asleep anyway. However, if when we finish up talking about sleep, if you take things for sleep, and we'll talk about this here in a little bit, and don't go to sleep, then you might do things you don't remember later. Interestingly, high anxiety itself may worsen memory. We do know that significant levels of cortisol, which is released in anxiety situations, has a negative effect on memory. So in very anxious people, it turns out benzodiazepines might not be amnesic, that is, they might not have such a negative effect on memory. We know that GABA is known to inhibit long-term potentiation of the hippocampus, and this is a neural process believed to be responsible for memory consolidation. Primarily, these drugs have an effect on explicit memory, and I can refer you to papers by Elliot Hirschman and myself. Critically, people are unaware of their effects on memory, so we have a paper out that came out in 2004. There's also a good paper by Miriam Mintzer up at Johns Hopkins, and another one by Elizabeth Bacon. Francis Bacon. Elizabeth Bacon, who is from Paris, as I recall. All very similar in their findings, and again, a great series of papers. Combined with alcohol, they have severe effects on memory. So you don't know that your memory is affected, and when you combine them with alcohol, can cause very dense amnesia. Good news for benzodiazepine safety is there is a drug available called Flumazenil. This completely blocks the benzodiazepine receptor and completely reverses of any effects of a benzodiazepine given prior to Flumazenil. So this makes the use of benzodiazepines in anesthesia very safe. So if somebody is accidentally given an overdose of Versed, it can be instantly reversed with a little bit of Flumazenil. It blocks that benzodiazepine receptor. This is a complete benzodiazepine receptor antagonist. So it blocks the receptor and does not allow anything to bind to the benzodiazepine receptor, so it completely reverses those effects. In related news, there are a class of drugs called nonbenzodiazepine benzodiazepine receptor agonists. Generally, these are not anxiolytic. Most bind to the GABA 1A receptor. Currently, there are 3 on the market: zolpidem, which is better known as Ambien, zalflon, which is Sonata, and azopiclone, which is Lunesta. So zolpidem has a half-life of about 2 to 2.5 hours. So pretty quick. That's one of the reasons why you are up and functioning and don't feel generally any sort of ambient after effects. Pretty hard to overdose on this particular drug. Sonata, very short half-life, so it can be used on short notice. So even if you aren't going to get a full 8 hours sleep, for example, Sonata is not going to keep you asleep that long. And then Lunesta, again, similar to zolpidem and traditional benzodiazepines, has a much longer half-life, so there's an increased risk of next-day sedation. And this is the only non-benzodiazepine benzodiazepine receptor agonist approved for longer-term use in treating insomnia. A couple of things to keep in mind with these drugs. They do have significant side effects or potential for side effects. In particular, Ambien is known for the potential to cause hallucinations. And again, without getting too terribly personal, I've had the experience of Ambien-related hallucinations. Fortunately, being a psychopharmacologist, I know that that's a potential side effect, and so I knew exactly what was going on. So it made it kind of an interesting situation, but it was hard to sleep with all those people I could see. So be mindful of that. So if this is a drug that you may end up being prescribed or know someone being prescribed, there is the potential for hallucinations to occur. One of the things that happens or can happen with people who take these drugs is they can do what's called sleep driving. So the FDA actually requires all sedative hypnotics used to induce or maintain sleep include the warning of a risk of sleep driving. So what happens is people drive while not fully awake and have no memory for having done so. This extends to doing other things like making phone calls, preparing and eating food. So they'll wake up in the morning and think that somebody's broken in because there's food missing, or the refrigerator's open, or the oven's on, or their car's not where they thought it was. So it turns out what we think is happening is that the blood levels of the drug are sufficient to block memory formation, but not sufficient to induce a sleep state. So people aren't asleep while these things are happening. They're actually awake. They just have no memory for the event. So the last thing, second to last thing, I should say, to talk in this area when we're in the set of hypnotics is to talk briefly about general anesthetics. These aren't of particular interest from a psychopharmacological standpoint because we don't use them to treat patients for psychological disorders, at least in general, and there's not a great deal of abuse of these, although there is some, like nitrous oxide. So these are central nervous system depressants that are used to produce unconsciousness for surgery. They're generally administered through inhalation or injection. Some of the inhaled anesthetics are subject to abuse, particularly nitrous oxide, because it is available for other reasons. So whippets, or it's available for injection into automobiles, for example, for people who are trying to soup up their cars. Anesthetics involve GABA agonism, so the ultra-short-acting barbiturates, thiopental, are used for this. Propofol is, of course, very famous. This is the drug that Michael Jackson died while using. They structurally resemble GABA, so they are pretty potent GABA receptor facilitators. They have little analgesic or euphoriant activity. This is the reason why they don't really have much abuse potential, because all they do is put people to sleep. Their onset's immediate, so there's no, ooh, that feels good. It's, oh, and then they're asleep. So there's really no abuse potential there. Ketamine is one we've talked about previously. This induces both unconsciousness and amnesia. It's quite unique. It induces analgesia and psychedelic hallucinations. It's often a drug of abuse. Again, we talked about this when we talked about psychedelic drugs. Unlike other anesthetics, it does not reduce blood pressure, so this is important for critically ill surgery patients. So it has some important use. As we discussed previously, and we'll discuss when we talked about psychedelics and when we talked about antidepressants, ketamine appears to have the potential to be useful in treating depression because it has some metabolites that are active and potentially act as potent antidepressants. So stay tuned for that. So the final thing to discuss are other ways to treat anxiety besides these kind of sedatives. So anxiety may result in part from defects in serotonin transmission. All 6 clinically available SSRI antidepressants are widely prescribed for anxiety disorders. They're actually considered to be first-choice drugs for anxiety. Particularly, I think Paxil is one of the ones that's used quite often for this. Unfortunately, they, of course, have significant side effects. Buspar, or buspirone, seems to be another antidepressant drug that has been approved for use as generalized anxiety disorder. It's anxiolytic in a unique fashion. There's no sedation or hypnotic action. There's little potential for addiction or abuse. It has some antidepressant effect. Again, this is a selective 5-HT1A agonist, and is ineffective as a hypnotic for sleep onset. So this is only a drug for you treating anxiety, so it's certainly something to consider rather than taking a benzodiazepine. All right, well, that wraps up our discussion of benzodiazepine sedatives and some related issues. We will talk again soon.